My name is Vjosa Hyseni. I'm a psychological counsellor and a counselling psychologist in training. I consult at Psychological Health Spa. I decided to become a therapist because it was the type of profession for me that focused on empowering people. I think growing up, I was also quite curious about human behaviour, what drives us, what motivates us, but also what can lead us to a very self-destructive path. Helping someone overcome that particularly difficult period in their lifespan is something that I enjoy about being a therapist. I particularly enjoy working with clients who present with anxiety disorders, such as panic attacks and phobias. To clients, these difficulties may be very debilitating. So for instance, they may avoid certain environments due to preconceived threats. This in turn, this is likely to affect their mood and behaviour. However, what's so wonderful about therapy is that these difficulties can be overcome through cognitive reconstructing and also implementing strategies. I am trained in cognitive behavioural therapy and also psychodynamic therapy. I think it's important to acknowledge that there is no one approach that fits all, as humans are highly complex and very unique individuals. So there isn't a particular approach that I carry out with clients. At times I will work integratively, so I will use elements of psychodynamic therapy and mesh it with cognitive behavioural therapy. Cognitive behavioural therapy, which focuses on the here and now, is particularly effective for clients who present with anxiety disorders, such as obsessive compulsive disorder, generalized anxiety disorder, depression, and other types of anxiety-related disorders. Psychodynamic therapy, on the other hand, focuses on the deeper-rooted nature of a client's difficulties. It will look at how early life attachments have impacted interpersonal relationships and how emotions are being dealt with. Psychodynamic therapy is particularly effective for clients who may have been sexually or emotionally abused during their childhood years, who may have difficulties forming relationships, and for clients who present with recurrent depression. As well as English, I'm also fluent in Albanian. I'm originally from Kosovo and I spent the majority of my childhood years there, so I'm able to deliver therapy in both languages. During the process of my training, I gained hands-on experience with a wide range of psychological difficulties across the spectrum. So I've worked with clients who have presented with severe distress such as psychosis and schizophrenia, to clients who present with milder psychological difficulties and distress. So for instance, anxiety, depression, and other types of anxiety-related disorders. A good therapist for me is someone who's able to make you feel very comfortable in the room. I understand that therapy can be very daunting for some. So a good therapist will work with that. They'll be very empathic, but also very genuine. So an important part of talking therapy is providing clients with feedback about what perhaps isn't working so well for them. A good therapist will be able to deliver this to a client professionally, but also sensitively. The most rewarding aspect of my job is, of course, the celebratory send-off. I've had successful treatment with clients across many disorders and difficulties that they presented with. However, it's also important to highlight that the success that a client takes away from therapy is really dependent on their level of motivation. They must be very keen about therapy and bringing about change in their life.